Today we are going to discuss about habits that can lead to diabetes so that you can avoid such habits and lead towards a healthy life. Before knowing about habits, you should know that what is diabetes. Most of the food that we eat is broken down into sugar that is known as glucose. After that, glucose is released in your bloodstream. When your sugar level goes up, it gives signals to your pancreas to release insulin. With the help of insulin, our body is able to use that glucose properly in the form of energy. A person who is having diabetes, his body is unable to break down that sugar into energy. So there are two main types of diabetes. Type 1 diabetes, it is mainly due to some autoimmune problems like body attack itself, which stops your body from producing insulin. Type 2 diabetes. In type 2 diabetes, your body is producing insulin but body is unable to use the insulin in producing energy. Approximately 90 to 95% people are having type 2 diabetes. Now, what are the signs and symptoms of diabetes that can give you warning signs? Some of them are feeling more thirsty, extreme hungry, unexplained weight loss, fatigue, frequent urination, irritability, presence of ketones in the urine, vision problems, slow wound healing, yeast infection. Habits that leads towards diabetes. There are many sedentary habits that can lead to diabetes. One should avoid these habits for getting away from diabetes. Here I am going to discuss about that habits have a clear loop. These habits can be sitting all the day. Less activities is the biggest reason behind many lifestyle disorders like diabetes, thyroid problem, heart diseases, etc. You may move out from your house, goes to office there from like 8 to 10 hours. After getting back house, you watch TV till late night. Where is your activity? You should move as much as you can. This will not only maintain your health but also keeps your body glucose level to normal range. At least 130 minutes of physical activity is necessary in a week. You can also walk from your office to home instead of using a car. Taking stress. Stress may not link directly to diabetes, but it can be a contributory factor. When your body is in a stress, it continuously produces a stress hormone called cortisol, which is opposite to insulin activity. Stress hormone can make your sugar level to reach high and you may need more medications to lower your glucose level. Exercise is the best remedy. Many studies shows that exercise can bring your stress level down in a very inspiring way. You can also do it like taking few minutes break from your work and participating in some activities like in some sports, etc., or getting more sleeps at weekends. Eating more refined carbs. Refined carbs such as white bread, white rice, and maida are very bad for your health. When you intake refined carbs, it will stimulate your body to produce more insulin in the body. They get easily absorbed by your body and you feel hungry again soon after eating them. You should switch to complex carbs like brown sugar, brown bread, brown rice, oatmeals, etc. They take more time to digest. Releasing slow but continuously energy for a longer duration keeps the calories count that you are taking. Working late in night or waking till late at night for getting your work done or chatting till late at night has become the common habit of many people, and this is boosting risk of diabetes in such people. You should sleep well. Research shows that poor sleep can lead to high blood pressure and these are the risk factors for developing diabetes. Getting inadequate sleeps make you feel exhausted and stressed all the time. So for better health, you should sleep at night, set your timetable to complete work and have a good sleeping pattern. Skipping breakfast. Most of us usually miss our breakfast due to many reasons like getting late from work or you do not like to eat in the morning. Due to these busy hours, breakfast look like a time-taking activity. People who skip their breakfast are more likely to consume calories and fatty foods throughout the day. Eat before you leave for work or school. At least try this for a week and you will feel marked difference in your energy level. Take all meals on time can keep your blood sugar level to a normal range. Taking all meals on time can keep your blood. According to experts, there should be at least 3 hours gap between your dinner and sleep. Intake more proteins, take lighter food. Fats should come from healthy like olive oil, rice bran or nuts. Also taking small meals throughout the day can help you to reduce the protein size at the dinner. Habits to manage your diabetes. Move more. Everyone needs to do exercise daily. A human body is designed to move more, so a sedentary lifestyle can cause many problems. And if you are having diabetes, it compounds your symptoms. Getting your heart rate up and bringing up sweat for about half an hour daily can help in weight loss, rid of heart problems, and bringing your sugar to a normal level. Diet is important. If you are having diabetes, it means that you have to manage your blood sugar level, and for that you have to eat a healthy food that is not high in sugar or saturated fats. A healthy diet can reduce your risk of developing diabetes and helps to improve your symptoms. But this is not only the thing to consider. Controlling your proteins and eating at same times each day can also help to improve your condition. Quit smoking. Nothing good comes from smoking. If you are having diabetes, then smoking can put you in a serious danger zone. People who smoke have 40% chances of getting diabetes than those who do not smoke. If you already have diabetes, then smoking can be worse for you as it prevents your body from responding to insulin treatment. Go to sleep. While sleeping, your body regenerates and restores itself. If you are not taking enough sleep, your body cannot work properly. It is especially concerning if you are a diabetic person because long-term sleeplessness can cause many problems for you. Your body will produce less insulin and produce high amount of cortisol. That's really bad for diabetes. Lack of sleep can also make you less satisfied after meal. You may eat more and may crave for sugar and carbs, both of which can lead to your weight gain and exacerbate your diabetic symptoms. Calm down. Stress is the biggest enemy of the diabetes. This causes your heart beats faster, blood pressure spikes, and your blood glucose level out of control. Manage your stress with praying, spotting groups, and taking to the therapist can lower your blood glucose level, and talking to the therapist can lower your blood glucose level and improves your diabetic symptoms. It is most important to keep yourself as healthy as strong to withstand with the uneven life like grave jobs, pressure, etc. Remember that self-management strategies are meant to complement the care you get in primary care centers but cannot replace it. Regular checkups are very important. When you will visit any healthcare center, they will monitor you and make treatment plan for you according to your need. If your diabetic symptoms are more than you can handle, then make sure to visit your doctor. Building healthy lifestyle and making good communication with your doctor is very important to manage the risk factors of diseases. Do not feel embarrassed to talk to your doctor about your diet, exercise, or your weight.